And it goes a little something like.
Hey guys, it's Zoe and welcome back to Zoe and Amaya. Today we're breaking down term 12, Nurse 257, Med-Surgical Nursing. I'm going to tell you exactly why this term felt like Med-Surg 1, but with vengeance. Like, this term was, I'm pretty sure I got my first gray hair during this term, okay? But before we get into today's video, if Med-Surg has ever humbled you, go ahead and like this video because this term will test you on the backbone you built during Med-Surg 1. So without further ado, let's get into today's video. Med-Surg 2 focuses on complex adult conditions and multi-system management. So you'll cover advanced cardiac disorders, renal failure, dialysis, endocrine crisis like DKA and thyroid storm, neurological conditions like strokes and seizures, GI bleeding, liver failure, post-op complications, fluid and electrolyte imbalances, and high-level pharmacology integration. I personally like the fluid and electrolyte imbalance. Like how to figure out which one it is, metabolic acidosis. Like I like that kind of stuff. But you're expected to interpret labs quickly, understand ABGs, manage multiple patients, and anticipate complications. So this is real hospital nursing thinking. I will say, even though Med-Surg was my least favorite class, I hate Med-Surg, but it's very critical, especially if you're in a hospital setting. Like you can use Med-Surg every floor you go. So that is a pro. It was always a multitude of different disease processes and stuff like that. So it's a great learning experience, but always everybody's least favorite subject. Clinicals, they were definitely long. I'm pretty sure we had 8 to 10 hour clinicals for this one. You have multiple patients, high acuity, and you're constantly charting, or if you're a nurse student, constantly doing care plans. It's ridiculous. So you might have one patient unstable, one needing meds, one waiting for labs, and a provider rounding all at once. And it's controlled chaos, rather, fairly controlled. So I'm pretty sure this is where we had our nursing home clinicals, which was the freaking worst, but also fun at the same time. Like when they had activities, that was fun. They had sing-alongs, cards. I remember 2 old men also fighting in a wheelchair. His old man's name, I don't even know if I should say his name, but yeah, I think his name was like Herbie or something like that. And that was his nickname. I'm not even sure that was his real name, but he got in a fight with another old man inside a wheelchair. Me and my friend were just like, what the heck? Because previously we were at mental health. It was just like turn by turn, like a fight every turn. It seemed like after that, because after mental health there was fights. Then we went to the nursing home, fights, and it stunk. It's like when you go to a nursing home, the front looks beautiful. The deeper and further you get inside the nursing home, the stinkier it gets and the more depressing it looks. Like, I'm like, I feel like when they give people tours of nursing homes, if they want to put their family members in there, it's like pretty in the front, like this is where we're going to show them. You get in the back, baby, it is very ugly. Like, I wouldn't recommend putting your family member in a nursing home. This term was basically Med-Surg 1, but aggressive. Like, it's more complexity, more responsibility, and yes, still plenty of bodily fluids like Med-Surg 1. And on top of that, we also had a not so great teacher. I don't think she teaches anymore, thank God, but she used to say the meat and potatoes constantly. And I promise if I hear somebody say the meat and freaking potatoes, I'm going to lose it, okay? Because she did not teach that well. Like, I'm pretty sure we taught ourselves, and I did a lot of YouTubing and level up our end cards, so. And then one day we got there, she's like, okay, you guys are going to teach class. I'm paying for school, mind you. Why are you having us teach the class? Like, I don't want to learn from my nursing students. I want to learn from you. I'm paying. I'm not paying them. We're all paying to be here, so you teach the class. Hello? I'm not paying $50,000 for. Seriously? You teach the class. Thank you. How I survived, like I said, level up our end cards. I follow along with their YouTube videos, make color-coded Word documents, created Quizlets, and use my own whiteboard to rewrite my own questions and quiz myself, which is essential to retaining the information for me. I also started listening to Nexus Nursing, and then that was a game changer because their questions are top tier. So sometimes you need the content explained differently, and she kind of just like nails it on you, like, you know, if you got this wrong, you're Mrs. Society. And she inspired me to add questions in my video, so I will have that at the end of this video. I should do like 3 to 4 questions, so not as advanced as her, but you know, kind of gauging how you are before you take this class, kind of like a pre-test. So then you can go to her where you need like more questions, okay? But let me know how I'm doing on the question segment down below, and if you like it, like this video. What caught me off guard was how fast the patients can decline on a Med-Surg floor. Like, you might think someone is stable, and then labs come back critical, and if you don't understand trends, you miss it. Or if you don't know how to like properly advocate for your patient, things can go wrong as well. Like simple stomach pain. Like, I remember, this wasn't during nursing school, but it was like my first nursing job. I was on a rehab facility, and you know, on a rehab facility, you have to be stable. So if somebody passes away on a rehab floor, it's like, whoa, what is going on? Like, not many codes on a rehab floor. You have to be really stable. Like, I mean, maybe 1 to 2 patients, maybe 3 have an IV on the whole floor. Like, it's not essential to have IV. Versus on a Med-Surg floor, every patient has IV, basically. Yeah, every single patient needs to have IV. But there was a patient on my rehab floor that passed away from a blood clot. Like, he was fine, and then one day, like, he just had a blood clot, which is so weird because I don't even think he was on any DVT things, and he was only like 30 something. So that's just like how important it is to advocate if you see your patient doesn't have certain medications or anything like that, and that you know they should be on it, to advocate for them to be on it, because this man that could have been preventable if he was just on a blood thinner while just being in the hospital. So like Eliquis or heparin, something like that, while he's in the hospital, which most people are on for DVT prophylaxis in the hospital, but he wasn't on it. So just making sure you are knowledgeable to advocate for your patients. And I don't know if he had any signs. I don't know the details because I wasn't my patient, but I just know he passed away from that. I had like maybe 1 or 2 interactions with him, but that was it. So yeah, stay knowledgeable and pay attention to your patient's charts. Now, to test your knowledge, let's go ahead and get into the question section. So question 1, a patient with DKA has glucose of 480, potassium of 5.8, and a pH of 7.25. What is the priority action? A, administer insulin. B, start potassium replacement. C, give sodium bicarbonate. Or D, restrict fluid. Question 2. Which finding in a stroke patient requires immediate intervention? A, a BP of 170/90. B, slurred speech. C, sudden decrease in LOC, level of consciousness. Or D, weak grip. Question number 3. A patient with renal failure has a potassium of 6.4 and peak T waves. What is a priority medication? A, furosemide. B, calcium gluconate. C, sodium chloride. Or D, insulin only. Last question. Question 4. Which patient should the nurse see first? A, GI bleed with dark stools. B, CHF with 2+ edema. C, post-op with a respiration of 8. Or D, DKA patient awaiting insulin. Alright, that was the last question. Let us know how you did in the comments down below. Which question did you miss, and why did you think that was the correct answer? If you got it wrong. That's it for today's video. If Med-Surg humbled you, please comment the emoji with like the dripping sweat from the side to let me know that it humbled you. And if you had a teacher that made you self-teach, comment self-taught nurse, because we've all been there with at least one teacher. Don't forget to like, comment, subscribe, and share this video with some of your nursing friends or somebody thinking about nursing school. And I will see you guys in the next term video.